Bismillahirrahmanirrahim. Assalamu alaikum, dear audience. Today our topic of discussion is about a very common medicine which is used by physicians, internal medicine, surgeons in different ways, that is steroids medicine. And today we are going to discuss how these steroid medicines are going to affect the pressure of human eye and what are the consequences. Steroid medicines are used by physicians in different ways. Earlier we discussed about rheumatoid arthritis, joint pains. These are very effective medicines. These are used by chest physicians to control asthma and respiratory problems. These are used by surgeons when they are going for transplants, kidney transplants or corneal transplants, to control and to minimize the rejection chances. These are very effective and patients have to use these medication. If we talk about the skin, dermatology people, physicians, they use it very regularly in the form of topical ointments, creams, they are used. Even eye physicians use steroid eye drops. They use steroids in the form of injections in the eye, and also oral medication they are used. So you name it, the subspecialty, and they are using it, steroids, in one way or another. These are very good medicines, provided used under proper supervision of a certified physician who will keep its advantages and disadvantages, and after weighing these things he will prescribe the treatment. When we talk from the eye medicine point of view, the question is how these steroids, whether you are taking tablets, you are taking injections, you are taking inhaled form or drops form, how does it affect the eye pressure? Well, human eye is like a sphere structure, and it maintains its shape because of fluid inside. This fluid is constantly being produced and drained of the human eye. And as long as this balance is maintained, production and removal, the human eye maintains its normal pressure, which is, we can say, goes up to 19 to 20 millimeter of mercury, and it is measured with special instruments by eye physician. So this is a very important point, that the eye pressure should always be maintained so that the eye maintains its structure over there. But whenever this production or drainage is disturbed, the pressure inside the human eye increases. Any patient who's using steroids medication, he should get his eye pressure regularly monitored for whatever the reason they are using. The reason is that some people, we call it steroid responders, that when they take the medicine, their eye pressure increases, and if it goes after use up till 10 millimeter of mercury more than the baseline, we call it responders. Number one. Number two, if they have any family history of glaucoma, high IOP, intraocular pressure, and the parents, father, mother or sister and anybody in the family is already under treatment, so these patients should also go under screening. Also, very old patients, very young patients, or having diabetes mellitus, diabetic patients, they should also undergo proper screening. So the question arises, how does these steroids, we are taking orally, we are taking injections, we are putting eye drops of the steroids, ointment in the eye, even along the eyelids we are applying it, or sometimes injectable forms. How does it affect the eye pressure? What it has to do with the eye pressure? Yes, it has a relationship. We know that eye fluid is produced inside the eye by ciliary bodies, and it is drained by a fine network of channels, filtration channels, which we call trabecular meshwork. These are fine fenestrations like things which drain the fluid continuously. This is a very fine structure and fine drainage pathways in human eye. Just imagine about it, that the fluid is being produced in the eye and it being drained. That's why my eyeball structure is maintained. But what happens that these steroids go over there and they cause certain biochemical changes over there in these fine fenestrations, drainage channels, that the removal of the fluid from human eye is decreased. It no more goes out as smoothly as it was going outside human eye earlier. And when it is not properly drained out of the human eye, the pressure starts building up inside the eye. So you will see these patients that earlier if pressure was 19, 20 normal, now it is started increasing depending upon how the medicines are being used and steroids and the duration. Well, if we talk about acute, once the medication is stopped, the pressure can come back in steroid responders if it is used for small period of time. If we have used for chronic or longer duration of time, it will take some time to come back depending upon the duration of use, and the recovery of the pressure can be even months in such patients. But the problem comes that when the pressure increases inside human eye, it affects a very fine structure in the eye, and that's we call optic nerve. Optic nerve is the structure which takes messages from the human eye to the brain. And this optic nerve consists of almost 1.7 million nerve fibers. Just imagine that they are having 1.7 million nerve fibers inside one optic nerve. There's only one that we call a transmission line, in simple words. One transmission line, optic nerve, and it consists of almost up till 1.7 million it goes, the nerve fibers. So when the pressure rises over there, then these nerve fibers, which are very fine and delicate structures, they undergo damage and destruction and irreversible damage. Here in the diagram you can see in the photograph that there is optic nerve. It is conveying messages from the eye to the human brain. But as shown in other photograph, it is like a cable. Just an example I am giving, a cable which is having multiple wires. As I mentioned, these wires quantity goes up to 1.7 million. When the pressure builds up, these wires inside the optic nerve start dying. And once these nerve fibers inside the optic nerve are dead, they do not regenerate. the damage is irreversible. Patient keeps on seeing, working, he doesn't appreciate any changes because the damage is gradual. It is not acute. It is not like that immediately blackening or darkening will happen in front of him. No, it is gradual. As I have shown in this photograph, that the cable is over there and multiple wires are going through it. So even if, this is a gross example, even if 2-3 wires are damaged, the signals, the current, the charge passes through it. But the quality starts compromising. The intensity, as shown in the diagram also, the intensity of the bulb lightning is not that much bright, but the patients do not appreciate it because still the wires are working over there. And this process continues. If they keep on using medicines and the pressure remains persistently high, they keep on getting damage, and ultimately the optic nerve, which gives us usually a pink appearance, turns into a pale white, chalky white structure. And damage is so much done that we call it gets excavated. If this is the optic nerve, it gets excavation over there, and we call it bean pot appearance. Excavated, the damage has done over there so much that almost all the nerve fibers in the optic nerve are now damaged. And now the vision is substantially decreased. Now the patient realizes that something is wrong going on. So that's why it is very important, if we are using steroids medicine, to regularly get our eye pressure checked. Because pressure will reverse back, but the damage it has caused over there, if we are steroid responders, that will be a problem. But on the other side, steroids are very safe medicine. They should be used and being used by physicians in different subspecialties, provided they are used under proper certified physician care. So apart from this intraocular eye pressure measurement, also we can do visual fields. The photograph shown here, all those black spots over there are shown. This is called visual field examination, a special machine. Patient comes over there and he is asked to see certain targets. He cannot see those targets without going in detail. I'm just giving the baseline, and the machine gives the printout that in these spots patient cannot see. So this is mentioned over here, shown all black dots. This is the advanced damage over there. This is functional. But on the other side, if you want to see the structural changes, how much the optic nerve has been damaged over there, then we again have the OCT machine. Here it is shown in the circle that all red over there, outside normal limits, mentioning retinal nerve fiber layer analysis, we say. Retinal nerve fiber layer analysis. It gives us quantitative measurement of the different cross sections of the optic nerve and tells us how much damage has been done over there. So these two things are also very helpful in these patients. Apart from eye pressure measurement, visual fields tells us the functional much ahead of time. It tells us how much damage is happening. But this RNFL tells us the structural changes, how much damage is there. So one is for the functions, visual fields. It depends upon the response of the patient. So the black dots and spots are over there. But these retinal nerve fiber layer analysis in the red which are shown, these are not subjective, these are objective, these are independent of patient response. It just calculates over there how much damage has been done and comes in front of us. So these are things which I just wanted to share with my audience about the regular eye pressure measurement. Visual fields can be done. If there's something suspicious, retinal nerve fiber layer analysis can be done over there. because this is something very sensitive, as shown in the photographs earlier also, that the optic nerve keeps on losing its pink appearance and develops, and gradually if things keep on, it becomes at last terminal stages, it becomes chalky white. We call it atrophic changes. So before that, so many things can be done. Screening can be done over there. If pressure is high, the medicines can be changed or temporarily can be stopped under the physician care. If they cannot be stopped, eye drops can be used to control the eye pressure over there. If eye drops are not working, we can do lasers in the eye to control pressure. We can do surgery. So many things can be done, keeping the situation of the patient. But otherwise, the steroids are perfectly normal. No problem. Patients are using since decades, provided these are used under certified physician care. And these certain precautions are done. I hope my today's presentation will be beneficial for my respected audience. I want to thank them for their attendance and attention. Thank you.